Hello, everyone. This is Chris Frederick with the Stretch to an Institute. And I'm really excited today to be with Stephanie, one of my students. And she's a physical therapist. So I'm particularly interested in my colleague in this case, my sister PT. And Stephanie, welcome.
Thank you so much. I'm excited to talk to you as well, Chris. It's an honor to be here.
Thank you. Well, why don't we just start about having you tell us about your PT career and kind of
Mhm.
what led you up to this point.
Sure. Yes. I went to Ithaca College. I'm from New York, so I went to Ithaca College for physical therapy school a very long time ago. Enjoyed the program and worked in orthopedic setting for 19 years and just two offices within the same company. So this was a place I actually worked on in my high school time as a tech doing laundry and stuff for them. So I stayed close to home, but got a job before I had even passed my boards yet and started working there. High volume orthopedic clinic and gained a ton of experience. And um, changed offices halfway through, about 10 years in, and did some management in the middle of that for about 5 years, and just struggled for a long time to keep up with the pace of the demands of the schedule and the documentation, and didn't really feel very appreciated or valued as a part of their team. And during COVID, I realized that I didn't need to change careers, but I liked what I was doing just at a much lower volume. So it reminded me that this is something I do like to do. I just like it at a slower pace with more connection, and started looking for other options and eventually got into building a business of my own. And with that time freedom that came with that, it was a slow transition, gradual over 2 years, but I had more time for continuing education, and FST came across me and it just kind of really resonated with me. So with that time freedom, I was able to pursue the trainings, and it's really changed my whole approach. It's really kind of invigorated my PT practice with using the skills I had from before and for college and for my experience, and then adding these new skill set to it. It's really just opened up my whole world.
Wow, that's really just so wonderful and inspiring to hear. So, did you just discover FST and stretch twin from Google search? Did you meet someone? Did you ever receive FST in the past?
I
Fascia
did.
stretch therapy, for those who don't know what FST is.
Yes. I had a strange story with it. I love podcasts. I was listening to a podcast and I heard this captivating woman who I thought was really, really interesting. She was talking about her practice as a fascial stretch therapist, and she's based out of Austin. And I was recanting this to my best friend, and he said, "Well, let's go to Austin and get stretched." So we flew down and made a trip of it and had a wonderful time and really connected with this provider. And so much so, we went back a few years later, and I was telling her, I'm interested in this. What was your path like? And she led me to Stretch to Win.
Well, that's really fantastic that you got a referral from one of our wonderful graduates. I think I know who it is.
Yes.
um, so basically, let's compare and contrast your old life as a PT in the traditional settings, I will say, and your life now. I think people will
Yes.
be interested in hearing that. I've never heard any PT who's in the system really feel like they're thriving, getting enough rest, very happy and satisfied. I know I experienced the same thing when I worked in the hospital setting where I had to stay after work. A lot of people stay 1, 2 hours, maybe more, depending on how quick you are. And back then, we didn't have a whole lot with the EHR, electronic health records. Everything was, by pen and paper.
Mhm.
But anyway, it would be nice to hear your compare and contrast thoughts.
Sure. Yes, very different. To what you're saying, high volume, so you're constantly feeling overwhelmed and rushed. The documentation all comes on my own time because when I'm working with patients, I want to give them as much of my attention as possible. And I'm supervising myself and an assistant, so we have about 25 to 32 per day. That's a lot of people. So I'm providing the hands-on manual care and then progressing their programs. So there's not a lot of time to chart or document during the shift. So that would come during my lunch or after shift. So it's about 5 to 10 hours a week of free work, basically, if you're salaried. And I'm not afraid of working hours or extra hours, but it starts to take a toll on your life and your sleep schedule. And I constantly felt overwhelmed and like I was kind of frantically running around, not sleeping well. When you're out of alignment with your own path, you end up with other things going on that are subsequent. Um, I wasn't wanting to do anything socially because I was so burnt out from the week that I would want to sleep half the day on Saturday and Sunday, and I really didn't really want to go out and be social. So it impacted a lot of areas of life. Um, what else did I?
What about patient care? So I hear you that how it affected you in a negative way. You do the best you can, but it's pernicious over the years. It eats away at kind of your soul in addition to your physical body. And so that's not good for your own health.
Right.
But then I'm also thinking about, hand in hand with people you're working with, you do the best you can. But if you're not feeling your best and you're feeling overwhelmed, can you really give the best care?
Right, I agree. No, I don't think you can. I think you do your best, but you're starting from a sleep deprivation yourself to go, and people who are coming in are having one of their worst days possible, right? There's post where I was working was a orthopedic group, so we're post-surgical, pre or post for majority of our caseload. So they're having a really tough time, and you're feeling rushed because you have two or three more people coming in a half hour. So you're kind of rushing them through their subjective and maybe not giving as much cueing as they really deserve or need. You're giving them instruction, and my assistant's coming behind me to help support. But there's still, at some point, maybe six people that we're supervising at once. So no one's getting 100% of your attention. And the therapists in that model, they're doing the best they can. I don't want to say anything negative about
Yeah.
that, but the model makes it difficult. And specifically in New York, the insurance reimbursement is about 50%. So in order for a business to function, they have to increase that caseload. But yeah, the care suffers and the patients deserve better and the providers are burning out. So it's a tough recipe for helping people through it. And unfortunately, in my case, the corporate environment didn't really, they don't have a lot of concern for your personal wellness.
Well, let's talk about how you feel now with your health and your sleep and how you feel about giving the right care for the right people at the right time. I'd like to hear
Hmm.
about that. And I know it started around the pandemic, you made your shift, right? But that was then pre FST.
Hmm.
Then you did FST. So it'd be interesting to see just that evolution from you,
Hmm.
to hear that from you.
Yeah, the way I had designed things now, I'm only seeing 4 to 5 patients a day, usually four. And I can spend time with them and connect with them. And I'm not relegated to just one body part, with the other volume, with the other setup, it's here's the PT script for a shoulder, and you can work on maybe the neck if it's related, but you really can't, insurance won't cover you looking at the whole body, and you don't have time to.
Right.
So now I have the time to do a full assessment on the whole human. And my favorite aspect of that is their emotional and their personal life too. What's going on in the rest of in this person's world that contributes to their pain and their stress and their sleep and all the other factors and how's their nourishment, and all of those factors go into how we heal. So being able to explore each one of those avenues because I have the time to really connect with them. And if we spend the first session, just talking over the history and figuring out goals for 30 minutes, then that's time well spent. And I don't feel rushed and they don't feel rushed. And then they're able to share with you deeper things that are really part of the whole story. You're gaining trust, so you're getting to the root of the cause. I find it really enjoyable because you're able to offer much more to this individual. You're able to offer the comfort and the connection and the hands-on care and the clinical assessment. And I find it a more effective tool for pain management than just my PT skills.
So would you say that people are responding differently than they did before? Just an overall impression when patients know when you're rushed, they
Hmm.
feel it, and now they don't. What's your subjective sort of feeling about that comparison with what you feel from the patients?
It's a great question. Yeah, they connect with you much deeper. I have, in my other setting, it wasn't common for someone to come up and hug you when they want to leave the session. And I find all my clients now, they want to come and hug you. You've probably experienced this too.
Yeah,
There's a deeper connection there,
that's
and
huge. That's
people
huge.
aren't often heard. So giving someone time and space to tell their story, and then you build this relationship with them that is much more than what I was doing before. So the clients, you have an impact on their lives. You're not just an hour of their day, but I'm checking in on them and seeing how they're doing and following up. And they're so appreciative for just a little bit extra TLC,
Well, we as PTs are forced to treat diagnosis and not the person.
right?
And I don't know if everyone understands that, but you know what I'm saying. You treat the lumbosacral osteoarthritis.
Yeah,
And meanwhile, there's the rest of the body that actually impacts that. And if it's chronic, it's an upstream, downstream consequence of secondary, tertiary, and quaternary even factors that need to be addressed. And if you can't touch the foot because it's pronated and it's internally rotating the whole kinetic chain, which causes increased shear and force on the low back, and you can't treat the foot and the consequence of that because it's not in the diagnosis. I mean, you're not treating it right. We're working for the insurance company. We're not working for the patient.
bingo. Yeah, it's really relegated by the insurance company and what codes they'll approve that year. That changes. That's a moving target as well. But you're so right. If you're looking only at the knee and you don't look at foot mechanics or gait mechanics or balance or hip function, you're missing the rest of the picture. Your exercises will help because a lot of people aren't moving, but you won't have long-term relief if at that approach. You'll get some initial pain relief, but that may come back because we haven't fixed the rest of the mechanics.
Well, I don't know. If I was out there in the system, I'd be really inspired from what I just heard from you. But in our final minutes here, any words of wisdom for PTs who might feel like they can't get out? I mean, you got out.
I did.
Any
I
words of
did,
wisdom
and it's
about?
night and day. It's night and day as far as
Okay.
enjoyment goes. I'm getting a full night's sleep. I'm not rushing through my meals and inhaling them at a, 5-minute pace. And just a happier, I have more time to meditate and exercise and take care of myself. And the thing I would say to someone who's feeling burnt out or feeling like maybe they need to change careers because they just can't do it anymore, you may not need to change careers. You can still use your clinical skills and the things that you like about physical therapy and apply them to fascial stretch therapy because you're still developing those connections and helping patients, and I find even deeper than you were before. But it takes away a lot of the pain points of the the insurance model system. So there's definitely another option out there, and the trainings are enjoyable. I don't know about you with continuing ed. For other continuing ed courses, you're kind of knocking them out because you have to. I enjoyed myself so much at the trainings with you and Anne. I didn't want it to end. I mean, it's not like a hard, unenjoyable thing. It's really stimulating. It's very supportive. It's a very enjoyable way to learn, and I found it life-changing, truly.
That's fantastic. So FST itself, fascia stretch therapy, what has that done with your sort of treatment paradigm, like what you did before, and how has FST changed your analysis, your assessment, your evaluations off the table, on the table, however you want to express it?
Great question. I have a better understanding. I didn't really know anything about fascia. I'll date myself. We dissected it out of our cadaver labs and discarded it. It was an inert tissue that was not something we learned about. So now that I have an understanding of the network of fascia tissue, you can see how one area may be connected to another through that line. You can see how the jaw may be connected to the hip or the foot. You can see those connections, and maybe you start working away from the source of pain first and make your way down into that painful area, and you have um, another pathway to target those symptoms. So I think I have a better understanding of how all these systems tie together in the body. And And it's enjoyable to feel, some of the things I had to do in a post-operative scenario would be to force people's knees into an extension range that they didn't want or a
Yeah.
flexion range that they didn't want and break up scar tissue and force frozen shoulders. I mean, these were things that I was, through the MD and the management system was really pressed to do. And having the opposite, where it's a lighter approach, a gentler approach, and having there be no pain with it, it's a totally different thing. For example, I had a new patient last week and I welcomed her in. I had already done a discovery call with her, I had a little bit of an idea of what we were going to do. And I said, are you ready to come back? And when I was asking about her expectations for the day, and she was like, I know I'm going to be sore. I know I'm going to hurt. I'm like, oh, okay. This is a common thing. This is a common belief that people are afraid to come into physical therapy because they think it's going to hurt or they think they're going to be sore after or it's going to be an arduous thing. But I love ending my sessions with some fascial stretching because they feel good leaving. They don't have to wait 12 weeks for an outcome. They feel good already. And
Mhm.
what we do with the strengthening beyond that only adds to the picture, but they're already feeling relief just from the mobilization.
Well, if someone wants to see you and they are listening to this interview, would you like to share your contact information, they can get in touch with you?
Absolutely, sure. My company is East Meets West Physical Therapy. My Instagram handle is at EastXWestPT, and email is Stephanie at eastmeetswestpt.com.
Well, that's fantastic. Well, it's been wonderful. You're very inspiring. I hope that PTs are inspired to take heed and they do have a choice and they can have actually make sufficient income by working smarter, not harder, and having, I think, a better quality of life is really what it comes down to, and actually have better patient outcomes.
You're so right. Better patient outcomes, better quality of life, and definitely some financial increase as well.
Awesome. Well,
Yeah.
thanks so much, and
Thank
I'll
you.
be in touch.
Thank you so much, Chris. Thank you to to you and Anne for developing this and for putting all your passion into it. It's really been remarkable for myself and my community.